Hello, everyone, and good afternoon. My name is Alexa Carey, and I'm the Partner Relations Coordinator for both the South and the West RPUs at Care Compass Network. Today's Lunch and Learn, titled Building Resilient Food Secure Communities. Before we get started, I would like to go over a few housekeeping items. To help eliminate any background noise and to ensure that all attendees can hear the speakers clearly, please keep yourself on mute. We do encourage you to turn your videos on, but if you're unable to do so, we totally understand. If you're experiencing any lagging or video quality issues, please try turning off your camera and back on again. If issues persist, please feel free to send me a private chat. This Lunch and Learn will be recorded and be uploaded to CCN's website. At the end of the panel discussion, there will be a question and answer period. Please don't hesitate to place questions in the chat box throughout the presentation or during the question and answer period. The chat box is located at the bottom of your screen. You're also welcome to utilize the raise your hand feature, which is also located at the bottom of your screen under reactions. I would now like to pass introductions to Georgia Entwistle, who is CCN's Workforce Development Manager. She'll be introducing our panelists today. Georgia.
Thank you, Alexa, and good afternoon, everyone. Our moderator today, Erin Summerly, is the Director of the Food and Health Network at Rural Health Network of South Central New York, based in Binghamton. Erin works to link food access, health, and sustainable agriculture through programs like Farm to School, produce prescriptions, and regional education policy and capacity building. She began her work in regional food systems while farming in Chelsea, Michigan, where she was first exposed to Farm to School. She has been with Rural Health Network since 2012. Joining Erin are four exceptional panelists: Amelia, Natasha, Baz, and Annie. Amelia Ladolsi joined Vines, Volunteers Improving Neighborhood Environments, as the organization's first executive director in February 2016. She began volunteering with Vines in 2008 as a founding board member and was also the coordinator of the Liberty Street Community Garden. Prior to joining Vines, Amelia worked for United Way of Broome County, spearheading the Healthy Lifestyles Coalition's Eat Well, Play Hard Binghamton's project. In addition, she worked as the City of Binghamton's first sustainable development planner. Natasha Thompson is the president and CEO of the Food Bank of the Southern Tier in Elmira. She has nearly 24 years of experience in food banking and started her career as an AmeriCorps Vista volunteer with the Rhode Island Community Food Bank in 1997. Natasha has been with the Food Bank of the Southern Tier since 2001 and has been in her current role since 2008. Under her leadership, the Food Bank was recognized in 2017 as Feeding America's Food Bank of the Year. Natasha believes that food brings people to the table, both figuratively and literally, where conversations happen, relationships take root, and communities can be transformed. Baz Perry is currently the Equitable Food Systems Coordinator at Cornell Cooperative Extension of Tompkins County. She manages programs that seek to boost access to nutrient-dense farm food among BIPOC, low-income, food insecure, and others who have been left out of previous local food movements. These include Farm to School and Food as Medicine Tompkins, a prescription produce program, as well as support for local direct market farms, farmers markets, and Healthy Food for All, a cooperative of 10 farms providing subsidized CSA farm shares. She serves on the Tompkins Food Policy Council, which is undergoing a community-wide food system planning process to assess the local food system, make policy recommendations to the county legislature, and provide strategic direction for local organizations. She recently served as an advisor to the Tompkins COVID-19 Food Task Force, a cooperative of 70 organizations brought together to coordinate shifting food access during the pandemic. Baz is an avid cook and a master gardener and is building her own small farm in Danby, New York. Annie Hudak is the Senior Food Service Director for Broome Tioga BOCES, where the Rock On Cafe oversees 15 school districts in Broome and Tioga County. Annie has been working in child nutrition for 8 years. It's my pleasure to turn the program over now to Erin, Amelia, Natasha, Baz, and Annie.
Great. Thank you so much, Georgia. And thank you all for joining. Before we get into our discussion this afternoon, I just really wanted to, kind of set the stage of what we're here to discuss with all of these wonderful partners. As so many of you are aware, the COVID-19 pandemic has really reinforced the importance of the connection between the food that we eat and our health and resiliency. And at the same time, it's highlighted so many inequities and really challenged the structure and stability of the food systems that we rely on to survive. And one outcome of this is also revealing important opportunities that we might be able to look to in the future for investing in community health and strong food systems, and addressing food insecurity, of course, to really get towards better health equity. So I'm excited to dig into some of those topics with all of our great panelists here today. And we're just going to have a back and forth discussion. So please be thinking of questions for our Q&A session later on. To get us started, I'm just going to ask each of you on the panel to provide a brief overview of what your organizations do and your work to address food insecurity, improve access to nutritious food, or support regional food systems. So I will start it off with Natasha.
Thanks, Erin, and thanks everyone for being here. So the Food Bank of the Southern Tier is headquartered in Elmira, New York, and we provide food and other grocery items to a network of about 165 community-based organizations across a 6-county region. So from Cornell on the westernmost tip of our area, a service area, to Deposit in the east, and all sorts of places in between, including up in Ithaca, Watkins Glen, and the like. So mostly rural community, and so and challenged economically, I think, and we saw that considerably during COVID. So if you were to come to the food bank, you'd be in a giant 65,000 square foot warehouse. We have a fleet of trucks that are on the road every day, bringing food out into the community, picking it up and bringing it back here. We have volunteers that help us sort it. There are a lot of hands that go into this work. We do have a commitment to nutrition. We have a nutrition policy that provides us with guidelines on what we will and will not accept, and that's been in place for about 5 years. We have 4 now nutritionists on staff, which is exciting, and we do our best to, one of our main focuses around nutrition has been, increasing the amount of fresh produce that we distribute. And we have a budgeted amount every year that we spend with our local farmers. And we're not just relying on them to give us donations. We know that oftentimes farmers struggle. And so we want to do what we can to invest our resources locally to help support the local farm economy. And oftentimes, they do end up donating to us because we've built that relationship. And so, there's a lot going on, but that's where I'll stop.
Thanks, Natasha. And Amelia.
Thank you. So Vines is, our mission is to create a just and sustainable food system. We do that by providing folks with space to grow their own food, and also connecting them to local farmers to get their own. So we have 19 community gardens where people can rent space. What they grow in their garden beds is for themselves and their families. We also have a 2-acre urban farm in downtown Binghamton where we hire youth who work at the farm year-round, help us grow food, which we then get out to folks through our farm share program. which is an all-income CSA program or a veggie subscription. So folks can pick up a box of produce for during 20 weeks of the growing season. We distribute about 200 boxes of produce every week. And through that program, we purchase about $70,000 worth of local produce from other farms to supplement what we grow. We launched last year a Build a Garden program, building raised beds at people's homes to help them be able to, folks who are maybe homebound or have other challenges accessing community gardens, allow them to grow at home. And we also have a free workshop series. So for folks who don't know anything about growing food or maybe are intermediate, there's a lot of very accessible content that we have for folks on how to get started and be successful gardening or cooking the produce that they receive. And that's us in a nutshell.
Thanks, Amelia. And Annie.
Thank you, Erin. I'm the new Senior Director of Food Services for Broome-Tagabosi's Rock On Cafe as of today. Mark Bordeaux just recently retired. We oversee 15 districts throughout both counties. My team and I work tirelessly to try to continue to improve food access to the students we serve at all the districts. We want to ensure every student has food available to them, whether they're learning in person or virtually this year specifically. And our work doesn't stop when the school year ends. We work throughout the summer to ensure that we have, lots of feeding sites available to all the students access free of charge. We provide breakfast, lunch, a fresh fruit and vegetable program at some schools, after school snack, and dinner programs. Thank you.
Thanks, Annie. And Baz.
Good afternoon. Thanks for inviting me today. I work at an extension office, and as many of you may be familiar, we have our roots in using academic research and participatory research from the community to develop educational programs from everything from agriculture and commercial production of food, home gardening, preservation, cooking, and nutrition, and a lot of other things in between and that surround food, like the family dynamic around the table and other things from home economics. But why I'm here today is as an educational organization, we really also try to translate that research into programs as well and combine education with food access. And so 3 of the main food access programs that we run here in CCE Tompkins, the first is Food is Medicine program, which I'll hopefully have a chance to get into a little more later. We have about 50 to 75 participants every year that go through an educational program about shifting their diet to nutrient-dense fruits and vegetables, and also receive a weekly allotment of fresh fruits and vegetables from local farms. We also run a subsidized CSA program, which we hope the Food is Medicine graduates will join. It provides a CSA share on a sliding scale. It's called Healthy Food for All, and it's celebrating its 15th year this year. That initiative has been growing for many years, and this year they celebrate by having some wonderful partnerships with BIPOC organizations and have enrolled 74 BIPOC community members in a CSA share for the first time, and are providing cooking education and gatherings to help people eat some new foods and have culturally relevant dishes, but also integrate some new items that grow here in New York. We also run a farm to school program here in Tompkins, very similar to others that are mentioned. It's focused on getting high nutrition dense foods into the school districts, and we work with 29 different school districts in this county to make that happen. They work so hard, and so we're happy to help them in any way we can. In addition to those direct programs, we have some things that we participate in that are collective impact style ways to shift policy and make systemic change in the system too. And we really feel like that's how we're going to get past the point of constantly needing to create Band-Aid programs that we've been running for many years. So we're very excited that right now there's a lot of momentum in that work.
Great, thank you all. Obviously, there have been big changes and big impacts to organizations who are, providing food or addressing food insecurity and those needs in other ways. And I'd love to hear from some of you on just what are some of the key ways in which either the services that you provide or just the ways that you work with the community have changed in light of COVID. And are any of those adaptations, are you planning to continue any of those new ways of work or new things that you've started in response into the future? And I think I'll start with Natasha, if you want to weigh in on this one.
Sure, sure. So, you know, last year was an unprecedented year for the food bank in terms of how much food we distributed and how many people we saw. And we really needed to pivot on so many of the different ways that we, you know, had traditionally been distributing food. We moved to drive-through distributions. Many of our food pantry partners moved to or tried to adopt contactless distributions where people could either order online or they would use a whiteboard from the car and say what they wanted and people would run in and pack. There were all these different innovations that happened. Meal sites, you know, the soup kitchen model where people would come and share a meal at a table, that transitioned all to takeout, right? And so just the level of creativity and innovation was really incredible to see. And what we didn't anticipate was that the people that we served would actually enjoyed these different methods more than they did before. You know, that the drive-throughs became very popular, for example, for our mobile food pantry distributions, where they just wait in their car, and we had volunteers put food in their trunk and then they were on their way versus the old way where they had to stand in line. And there's a certain amount of stigma. There's a tremendous amount of stigma when it comes to emergency food in certain cases, right? It doesn't feel good sometimes to ask for help or to admit that you need help. And so these different methods that we adopted during COVID out of necessity actually were things that people ended up enjoying more than they did. And so we're keeping that. We had to switch to an online registration system, which we're keeping on because people enjoy knowing, you know, in the past, they would show up to a distribution 3 hours in advance and wait in line because they wanted to be first, because they wanted to be sure that there was food there. There've been a handful of times since we've been doing these programs, since I've been at the food bank for 20 years, that we've run out of food. We don't run out of food. Rarely, but there's that sense that they will, this unknown. But now people sign up, they know that when they get there, they will have food, so they're not showing up 3 hours in advance. They're coming. It's all very civilized. You know, there's a certain, I don't know, I think all these things help address that stigma issue, which had prevented people from coming to get food, especially, and then people with young kids, they can be in the car. All good things. So we, you know, that and many more examples of ways that we've had to shift. I think while it was hard and it was challenging in many ways, it allowed us to do things in such a different way. And many of those things we're not going back to. You know, for us, there was a challenge in the supply chain where we couldn't get a lot of canned goods, a lot of, you know, pasta. You can get a lot of those things that you traditionally associate with food pantries. We had a lot of fresh produce through Nourish New York program, through USDA. We were distributing a lot of fresh produce, a lot of dairy, a lot of, you know, frozen meats, and people loved it. We got rave reviews on the quality of the food. So now it's like, how do we continue to do that? We don't want to go back to some of the ways that we've done things. Now that we've discovered this new way and we've gotten positive feedback from the people that we served, we're going to do what we can to continue to provide people with that quality of food, which ends up being the healthiest food. It's sort of like a win-win for everyone. So, yeah.
Great. Thanks, Natasha. And I want to hold on to that thread around supply chains. I think, Baz, you might have some interesting follow-up, but I'm going to jump to Annie first, and then maybe if you want to jump in on anything supply chain related, but I'll hand it over to you, Annie.
Okay. The pandemic changed everything for us as a school district. You know, by mid-March last year, all of our districts we oversaw were fully remote, which we had never done before. We implemented a feeding plan to ensure, all of our students would still have access to food. Every district opened up feeding sites for anyone 18 and younger that could pick up food that lived in the area or outside of the area. We transitioned to doing those sites every single day. Eventually, by the summer, we were doing one-day pickups, which we saw a really big success with. We could do bulk items that families could really utilize, things like gallon milk, 1 pound carrots, things that they use on a daily basis, and that were easily accessible for them and to cook. By the fall, most of our districts had transitioned to also offering weekend meals to the students that were in person. And we saw great success with that. A lot of our schools really, they needed that. They needed to secure those weekend meals. So this summer, we're going to continue to have a surplus of open feeding sites. They're going to be free of charge, of course, and to make sure that all students in our area have access to food. Some districts are going to continue to deliver food on buses and SUVs to neighborhoods that they know are needing of food insecure and that need that extra help to ensure that they have access. If they can't drive to an open site, they'll bring it to them. State education did just put out last week, though, that we're going to have to stop the weekend food starting next school year. So unfortunately, we won't be able to provide weekend meals to the students that are enrolled, but we will continue our efforts to ensure our remote and hybrid learners have access to food during the school week. And we'll continue our partnership with the food bank of the Southern Tier to make sure that the confidential backpack program is still in place for all the families that they need weekly meals of non-perishable foods. And anything we can do to help families locate food pantries or anything for those weekend days that we can't feed their children.
Fantastic. Thanks, Annie. Bez, is there anything you wanted to jump in on in response?
So yeah, just thinking about how things have changed, I just wanted to briefly touch on, education obviously has had a huge change. Annie, you mentioned like hybrid and remote learners, and it's been really interesting to see, that a lot of that remote education does not work well for children. And so our nutrition efforts for kids and stuff, having everything on Zoom and video, it's just not the proper way for kids to learn. And we're hoping to go back to a social setting as soon as we can. But on the flip side, a lot of adults really benefited because transportation in a rural area has been such a challenge to attend cooking classes, gardening classes. And so we've seen a huge increase in attendance at these sort of adult learning opportunities around food and food access. And so we're very excited to continue that and offer some sort of hybrid model. We're purchasing technology now so we can even have some remote participants when we do return to a social setting for cooking classes and other food-related activities and events. And then the other thing that I just wanted to add too is that we also found that providing delivery of food made a huge difference last year. And I really thought, the volunteers and everyone are going to just disappear as soon as the vaccine's around and as soon as everyone says, oh, it's safe, people can go and get their own food again. But no, actually, all of the volunteers contacted us saying, can we start to deliver food again this season? Because they got to know the participants and it became very clear, no, transportation is a barrier, and it was pre-COVID. And here we are, we finally figured out a solution for a number of community members that really didn't have one previously. And so we're going to be continuing to deliver produce to families throughout Tompkins and write that into all of our programming from now on. So I'm really excited about that. And then Erin, you mentioned that I love talking about supply chains. I'm an economist by background. So in thinking about like one of the biggest surprises of this year for me was how resilient our food supply chains were. I don't know about you, but when the pandemic hit and we all saw empty shelves, the people who were convening in the food task force in Tompkins thought, oh no, we're going to run out of food. And there definitely were a lot of supply chain disruptions where, things took longer than we expected. There were price fluctuations, and there continue to be in food, and substitutions need to be made. But I was really pleasantly surprised that we did not run out of calories in Tompkins County. And Natasha, thank you for everything that your organization did to make that happen. But then, of course, the other side of that, which we saw at the national level, unfortunately, was an exploitation of workers to make that happen, right? The frontline workers, but also going back with people working in slaughterhouses and packing facilities in unsafe conditions. And I think it did really bring into stark contrast that the industrial food chain is going to make sure that their market propositions and their revenue streams stay intact, no matter what kind of chaos happens in the future. And so the takeaway for me for that is, first of all, to feel that tension between gratitude that I still had food every day, and then also that sort of anger and frustration about how it was arriving on our tables, and working towards a regional food system that can integrate our values more clearly in the future. And so that is the work of food policy councils, trying to establish different supply chains and different compensation models all the way from farm to table, so that higher wages lift people out of poverty and reduce our dependence on emergency feeding operations. And so I just wanted to encourage everyone to get involved in a food policy council if there's one in your community, because I do think that that's sort of, for me anyway, the biggest lesson of this past year is that we're in a huge state of flux, and it's an opportunity right now to make some changes.
Great, thanks, Baz. And thanks for sort of setting us up for a follow-up to open it up to others of, what are some of the other, I guess it's $1 million question, but what did you wish you knew, before the past 15, however many months going into COVID that you do now? And was that, I guess, what was the biggest surprise? So we'll go back to Natasha to start, and then maybe Amelia next.
Gosh, wow, that is the $56 million question. I think I mentioned it before. I think it's really like the resilience of the network, because a majority of the organizations that we work with at the food bank are entirely run by volunteers, right? And the average food pantry volunteer is a 75-year-old female. And we thought, oh my God, like so many of our agencies are going to close. They're going to be freaked out, because that was the demographic that was most at risk for COVID, right? And at one point, I think at the highest, we had 10% of our agencies closed, but that they were only closed temporarily until they could figure out a way to tweak their distribution model to serve people. And so that was just incredible to me. Just how many folks were so committed to this work that they figured out a way to make it happen. They were able to, I think Baz mentioned, they were able to recruit new volunteers, younger volunteers, people who were furloughed or laid off or whatever, that jumped into this work and with gusto, and I still continue to do it because they were so inspired by it. And then all those things that we kind of knew were issues before, like transportation, like, the challenge homebound people for whatever reason who couldn't go out, and we were like, how are we ever going to crack this nut? And just having the community come together to figure out ways to make this work was just so inspiring, right? So the resiliency of our network, but also the resiliency of our communities when we're working together with a common purpose. It was just so wonderful to see, and just proof that so much is possible when we do work together.
Yeah, absolutely. Thanks, Natasha. And Amelia, how about for you?
So something that we saw last year that was really striking was that our community gardens were renting out at a faster pace than they ever had. So we often have garden beds still available for people to rent in May, but we were selling out gardens in February and March. So we had planned on launching our Build a Garden program to help people grow at home in raised garden beds and also garden bags. We planned on launching that in the fall, and we decided to just throw it together and launch it really quick in the spring. And we were able to serve about 75 households through that, just kind of throwing it together really quickly, which was impressive. And because we were out stores, we were able to easily get volunteers together safely, and people didn't have a lot else going on. So they wanted to pitch in. But something that we, I wish I had known then and could have focused on more was, as you all know, we were seeing food fly off the shelves, but if you went to a gardening store, you couldn't find seed pots, you couldn't find seeds. Everybody wanted to garden at home. So knowing that, I would have, I wish I had had time to shift into a little bit more education on safe home gardening. So we had some great research done through SUNY ESF, and they found that about 50% of the folks new to community gardens were really coming into it because of COVID. They didn't have experience prior. They weren't familiar with issues like lead contamination. In Broome County, we have our lead poisoning rate is 15%. It's 3 times the New York State average. And a big challenge with home gardening in the urban core of Broome County is that we've had our houses built out, our communities built out since before lead paint was banned. And so we have a really high amount of lead in our backyards. And going out and building raised beds in people's houses, I was seeing a lot of people were growing in the most dangerous parts of their yards, which is the drip zone of the house. It's where you have the highest concentration of lead in your soil. And it can be, it can be so incredibly high that eating anything from that is very dangerous. So we, as a result, we're starting to do some free lead testing for folks. We're gonna, launch that a little bit more widely this year. But I think there's a real need in our community as there's such a surge in interest in gardening. People are coming to gardening for not only the social aspect, but food security. These are the 2 big things that we're seeing. But if people can't do it safely, we're just facing additional challenges and more lead poisoning for our kids, which is certainly something that is an important public health issue to address.
Yeah, thanks, Amelia. And so interesting. My next question is really honing in a little bit more on that relationship between food insecurity and health and nutrition, but thinking about there's that additional component from the gardening side and that aspect and its impact, hopefully not impact, but that aspect to be aware of as well as more people got into that. Really interesting. So yeah, we'll jump into my next question for you all. And the concept of food as medicine has been gaining significant support, particularly I think over the past year or 2 years. And many of you are already actively involved in that space, partnering with healthcare to improve access to food and nutrition. And just briefly, are there any new developments or successes in that space that any of you, would like to highlight? And I'll start with Baz and Natasha or Amelia, if you want to add anything in there after, go for it.
Thanks, Erin. Well, we all know that you're doing so much to propel this field forward. So thank you for all of your leadership. The food as medicine groups in New York have been growing in scale and quality, and it's really exciting to see. I think part of that is because the case has been made on the research side. The peer-reviewed publications are out that doctors and other healthcare providers are reading that show a really clear connection between participation in a produce prescription program or a subsidized CSA program or any other sort of fresh fruits and vegetable access program and very rapid health benefits with mitigation or even complete recovery from some chronic disease. And so what I'm seeing, and I'm sure others who work in this field see too, is that the health clinics are excited to participate. There's a really, actually too much demand for the amount of programs and funding available to provide produce prescriptions to patients who qualify. The other exciting thing I think is that there's been a lot of growth in the nutrition education field. to complement these programs, right? Because as I mentioned earlier, as someone starts to eat seasonal fresh foods from New York State, that may be a different bundle of produce items than what they're accustomed to eating previously. And so that education on seasonal New York produce and how to integrate it into different culturally relevant dishes and things that meet their palate and their preferences has been really critical. And SNAP-Ed has been working on this for years now and has a specific FBRX curriculum, which is great. There's also more funding available, which is spurring a lot of growth, both at the federal level and private foundations. And the thing that I'm most excited about personally and professionally is the amount of collaboration that we're starting to see and networking between programs. So Erin and I have been working together, and we've also put in an application to start a New York Food as Medicine affinity group with the New York State Association for Rural Health. And just that idea, even just talking together in the grant process, right, starts to create that peer-to-peer learning. And so we're all lifting up our program quality, and it's really exciting to see.
Awesome. Thanks, Baz. Natasha or Amelia, or both of you, you're welcome to jump in with anything.
I just really quickly, so I think, awareness of this is happening obviously more and more locally, but then also nationally within the Feeding America food banking network, right? I mean, for so many years, food banking came up in the late 60s, early 70s, and our primary metric was distribution. How many pounds of food are we giving out? Pounds, pounds, pounds. And I think, probably in the last decade, people started thinking like, wait, like pounds of food aren't all created equally. And what are we contributing to the people that we serve, right? In terms of, providing them with not the most nutritious food. And we know that, health and hunger and obesity and poor nutrition and chronic disease are all related. And so how are we contributing to that? And so we've definitely been more focused on, improving the quality of the food that we distribute and establishing partnerships with some of our healthcare providers to establish, on-site food pantries for people with diabetes, for example, or pre-diabetes. We're starting a pilot here in Elmira with that, and supporting other organizations' efforts to provide those prescription produce boxes. There are many different ways that we can get involved in this work. I think the question, it's just so new. And we have some examples of other food banks that have been doing this kind of work well. So a lot of it is just learning how we can best plug in, because our resource, what we bring to the table is access to a lot of these sources of fresh produce. And so, and then how can we be of service in that regard? We're certainly not the experts in this realm.
Yeah, thanks, Natasha. Amelia, anything from you?
Yeah, I'd love to add something. So our farm share program that I mentioned, we do offer a sliding scale fee for that for folks. We also participate in the Food and Health Network's fruit and vegetable prescription program. But last year we started working with Dr. Holmes, who has a family practice or family medicine practice in Johnson City. She wanted to provide free boxes of produce to 15 of her Medicaid patients out of her facility. And originally she thought she'd have them delivered to the office, and then people would come in and get them every week. It'd be a great way to keep touching base with patients. With COVID, they wound up deciding to move to a home delivery model. So we delivered shares to them, and then their residents delivered the shares to people's homes. And something that was really interesting that came out of that was it turned out to be an amazing learning opportunity for residents in seeing their patients' homes and having a greater appreciation for the poverty that people experience, the housing insecurity issues, the lack of quality housing that people live in. And so I think it's really important that for our medical students and our young doctors or doctors in general who may have come from more privileged backgrounds, they don't necessarily know what a lot of their patients are going through because they haven't lived it. No fault of their own, just they haven't lived it. And if we are going to affect some real policy change in our world, we need to have less separation, I think, between those who make decisions, the influencers, and the people who are experiencing the hardship. Because if you don't know what that looks like, you don't understand how pervasive it is, and you haven't developed a connection with a person who is experiencing that, it's very easy to ignore the issue, gloss over it, and not appreciate that it is not the fault of these individuals. They're just dealing with a variety of bad circumstances that have led them to be where they are. That doesn't matter though. We need to solve the issues. We need to better support the people in our communities so they are not facing such pervasive food insecurity, housing insecurity, other issues like that.
Can I just build really quickly on what Amelia said? You know, as part of what we're going to be working on with the ARNA here, we had medical students begin asking the two food insecurity questions to the people that were coming into one of their clinics, right? Just to get a sense of like, you know, how many people could we recruit to participate in this program? And I just quick looked up the number and, you know, out of 337 people that they screened through these questions, they identified 38% to be food insecure. And it really blew their minds. And these are young medical students, I think, as you said, you know, many of them coming from different types of backgrounds, and they just couldn't wrap their brain around the fact that 38% of the people that they were seeing were experiencing hunger and food insecurity. And I think just that experience alone has the potential to have tremendous ripple effects, you know, as they go on into their careers and move to other locations. I think having a cadre of doctors that understand this and are aware of this can lead to some significant long-term changes.
Yeah, thank you all. And just a quick shout out, since I think I don't see everyone right now, but I think I saw Seven Valleys Health Coalition represented on the call. Just wanted to shout out, if you're in the Cortland County area, they're running a great produce prescription, or will be starting a great produce prescription program as well. And also have to give a thank you to CCN for actually, I think, investing in a lot of our programs to get started in this field as well. So Amelia, and you know, with some of those last responses, you set up this last sort of like juicy question that I'm most excited for pretty well, which is really just, you know, what sort of opportunities or promising programs or policy levers for helping to build food security and improving our community resilience are you most sort of energized by right now? And I'll start with Annie and just kind of give everyone the chance to respond.
So we're in the process of securing our own refrigerated truck, which is very exciting for us. It's been in the works for a long time. This truck will expand our farm to school initiative, which right now we're trying to grow. We're hopeful that this truck will be the key piece that we need to expand our program and, you know, help to meet new farmers. With that, you know, going forward, one of the biggest obstacles we've had was the delivery logistics. And by having our own truck, we'll now be able to utilize smaller farmers that we weren't able to use and they weren't able to bid because of the delivery aspect. And, you know, using local farms helps everyone. The farmers help us by growing the food for our students that need it most. Some of them actually, you know, don't know what a Brussels sprout is or what cauliflower is or a beet. So they help us by growing food for our students. We help the farmers by purchasing the local products. And then our students are supplied with the freshest produce in New York State on a regular basis, where we're offering, you know, farm to school, you know, twice a month. Some districts are getting, you know, local apples. We get local milk all the time. So it's a big endeavor, and we're really excited to bring that to all of our schools.
Thanks, Annie. Baz, do you want to go next?
Sure, Annie, that is so exciting. I'm really excited to see what a refrigerated truck can do for a farm to school program. That seems like the missing link. So I'll wait to hear our update on that next year. I guess it's a big question, but one of the things that I see that I'm excited about is just different a shift in payment structures in the food chain of like who pays for what and how much they're willing to pay. I think the food is medicine movement is really showing that there's promise there in convincing healthcare insurers and hospital systems to pay for the produce prescriptions because there is such a huge return on investment in reduction in ER visits and medication use and repeat visits and everything for folks once their bodies start to heal through that fresh produce. And then also more private and public grants going towards like farm to pantry efforts and to farm market incentive programs. And it does seem like there's just a really big understanding that people living in poverty need the best nutrition that we can possibly provide in order to handle the trauma and stress that they encounter on a daily basis. And that everyone's better off, especially that person, but everyone is better off when everyone in the community is getting the nutrition they need rather than the calories only. So I think that shift in understanding that there's a nutritional security needed in this country instead of simply food security at the federal level is actually changing how our dollars are being spent because our goal is different now. So that makes me hopeful.
Fantastic. Thanks, Baz. And Amelia.
So I just want to say ditto to everything Baz just said. Absolutely excited to see the healthcare industry really embrace this issue more. One thing that I'd like to share is that through getting more engaged in working with people, doing home gardening, and thinking more about our role in supporting people who do want to grow at home is, we've thought a lot about one population in particular, a combination of populations. For individuals for whom English is their second language, we're particularly concerned about lead contamination in soil for those populations. We have a lot of new Americans in our community who, growing food themselves, that's a big part of their lives and their cultures. And so they're going to do that one way or another. And often, if you drive around different parts of the Triple Cities, you'll see a lot of folks growing, again, right in that drip zone of their homes. And sometimes you can tell by seeing what kind of crops are growing, what that family might look like. And it seems like we have a lot of folks in the Asian community in particular who are gardening at home, gardening in that drip zone. And so we're going to be doing a lot of work in the next couple of years to make inroads into those communities. And I think we see, we've seen some preliminary data in a variety of sources that there is, some extensive poverty in some subsects of the Asian, which is very broad, the Asian community, and high food insecurity. And these folks are going unsupported for a variety of reasons. So we want to see if we can do something, really drill down and do some targeted outreach, work with some individuals from that community, offer them stipends to help us with making inroads to better support that community in the coming years.
Great, thanks, Amelia. And Natasha.
Yeah, so I think what is promising and some of the opportunities that I see, I've been involved in food banking for a long time, and we've gone through some of these. We've never gone through a global pandemic, granted, but we did go through most recently, the Great Recession of 2008, and we saw food insecurity rates, jump up to 25% above what they were in 2007, and it took us almost 10 years to get that food insecurity rate back down to pre-recession levels, and then COVID hit. But the rates of food insecurity during COVID were significantly less than they were during the recession because of government intervention, right? The government made so many investments in these different programs. They allowed for flexibility in rules, and the first one that comes to mind is in school food, right? So many of our school food partners just were incredibly creative to deliver food out to kids, to provide them with several days worth of meals at a time, whereas before, that was against the rules, right? So we saw that when you have flexibility, when you invest in people, you invest in things like pandemic EBT and provide families with young children additional SNAP benefits, when you increase the lower limit of SNAP, when you flex the eligibility rules to allow more people to participate, food insecurity goes down. Oh my God. And so I want people to remember this, and I want us to work to ensure that the government does its part, because charity can't do it alone. And so we've seen how it can work. And I'm hoping that we can take this little breather that we've been given, I think, to really start to strategize and organize, a coalition of people who can fight against some of the proposed cuts, because the cuts will come because we forget, and it's really up to all of us, because I think we are very innovative in the nonprofit sector. We do as much as we can do with the resources that we have, but we really need to hold our government partners accountable, because that's really the only way that we can address food insecurity in the long term.
Perfect. Well, thank you for wrapping that up beautifully, Natasha. That's excellent. I guess with that, I'll hand it over to Alexa. I don't see any questions in the chat, but I'll hand it over to you.
Thank you so much. And thank you, all of you, for all that wonderful information. If anyone does have any questions, please feel free to place them in the chat box now. There wasn't a question, but there was a comment from Jackie Leaf after Erin, you made your comment earlier. But yes, I am on, but my microphone is not working. Great to hear everyone else is doing also. So was that comment in the chat?
I guess while we're waiting, just to hear if anyone had any other thoughts, do any of the panelists, any threads or things that anyone wanted to follow up on as we were all chatting?
I had one thought when Amelia was talking about the Asian community and getting educational materials out to them in their language and that are appropriate for their habits and what you see them doing in the gardens. It reminded me that we just recently did some community surveys on food insecurity and found that the Asian Americans in our community were much less likely to be enrolled in SNAP than other demographics, even though they were eligible. And so I do think that there's a lot of work to be done in translating materials and providing education to different pockets of the community. Tompkins is also very international. And so I think we have, there's some momentum there of having students and others, support a lot broader translation beyond the few languages that have been offered over the last couple of years. And alongside that, culturally relevant recipes and, just really educating everyone who works in food access about the diversity of interactions that we need to be prepared to have as we work in the community. So I'm excited to see that we've sort of gone past sort of the initial diversity, equity, and inclusion work. And I think we're really maturing as a culture in terms of really meeting people where they're at and without stigma and judgment, and finding a way to have a dialogue and support in ways that are appropriate.
I have two questions that came in. The first one is, what is the need for addressing hunger in the elderly population?
I guess I can take that. You know, during COVID, we actually did a study of underserved populations in our 6-county region in the Southern Tier as a way to identify who we weren't currently serving well and who is in need, who are we not serving, and you know, then to just generate recommendations for how we can better serve them in a post-COVID reality. And seniors, particularly homebound seniors, came up as a group that we were underserving relative to some of the other groups. And you know, I think it's challenges that we all can kind of think of where, you know, your people are living on a fixed income. They might have high out-of-pocket medical costs, especially if they're on certain prescription drugs that aren't covered by Medicare or Medicaid or however, you know, having to, you know, lacking transportation, being unable to drive, you know, the tax burden that they have on the property that they might own. You know, there are a variety of different reasons that our seniors are in need. But the flip side of that is that seniors are also very reluctant to ask for help. So it's a matter of reaching them and sort of like removing the stigma or this notion that I could use it, but someone else needs it more than I do. And there's this scarcity mentality. Like if I take this food, that means a family with a child won't get it. And that's just not true. There's more food that goes to waste every day that it's our job to find and redistribute before it gets to that point. And it's just a matter of reaching out and changing the narrative.
Great, thank you. A couple more questions. What about things like cooking utensils? Can everyone cook the foods they're given at home?
No, that's a great question. Oh, go ahead. You probably would have a similar answer. Camelia, go ahead.
Sure. You know, we see that all the time with folks not having fully, you know, fully working appliances and kitchens, all of that. So when we do recipe education, we keep things extremely simple. So you don't need a lot of items to prepare that dish. That is really key. But then also throughout our program, we work on using grant funds to get people things that they might not have. And so, you know, that is a very important issue to look at for sure.
There was a comment. Great job to Erin and all the panelists. Thank you so much for all you do. Very informative. There was another question as well. Are you aware of healthcare payer interest or employers in funding hunger/food insecurity?
I can start on this one. I know others can join in. I think the very short answer is yes. There's a much longer answer as well, but there's definitely a lot of, the employer question is interesting. I'm less familiar with that, but there's a lot of precedence nationally of managed care organizations and other like payer entities providing funding, whether it's for like food pharmacy types of things or actual produce prescription programs. I think the one type of program model which we're going to be trying to research more and transition into piloting at some point, hopefully, is the medically tailored meals model. That type of intervention is much further along in being pretty regularly paid for by insurers, but there is growing precedence of payment for things like produce prescriptions as well.